This Pride Month, we need to talk about LGBTQ healthcare. Hi, my name is Bijou Bassing and I use she/her pronouns, and I'm a medical student and a volunteer with Doctors for America. Individuals who identify as part of the LGBTQ community often experience intimate partner violence at similar or higher rates than non-LGBTQ people. However, a history of prejudice and discrimination towards this community has created barriers for care. When treating patients who may have experienced such violence, it is important to understand the intersectionality of these issues to provide culturally competent care. Here are some statistics from the National Coalition of Anti-Violence Programs. Transgender people are nearly twice as likely to experience intimate partner violence in public areas compared to people who do not identify as transgender. Transgender people of color are 3.7 times more likely to experience intimate partner violence in public areas as people who do not identify as transgender people of color. LGBTQ Black or African American survivors of intimate partner violence are nearly twice as likely to experience physical violence as those who do not identify as LGBTQ and Black or African American. LGBTQ survivors receiving public assistance are over 3 times more likely to experience physical violence and over 5 times more likely to be injured as those not on public assistance. Aspects of intimate partner violence in LGBTQ relationships are often similar to those of heterosexual and or cisgender relationships. However, LGBTQ people often experience multiple instances of discrimination and violence due to their sexual orientation or gender identity, causing additional barriers to seeking help. As medical students and physicians, we must be aware of the barriers LGBTQ intimate partner violence survivors face when seeking consistent access to medical care. When inquiring about a patient's sexual behavior and desire, be sure to do so in a non-judgmental manner. Use inclusive language, avoid using gendered words, and ask the patient how they identify and the language they would like to use when discussing their relationship. When safety planning for LGBTQ identified survivors of intimate partner violence, we must be aware of specific needs certain patients may have. These may include ensuring continued access to specific hormones or treatments, and knowing specific domestic violence shelters in your area that are welcoming of LGBTQ survivors. In addition, we must be aware of local institutions and resources for LGBTQ intimate partner violence survivors so that we can connect our patients to these resources. Finally, use your voice to advocate for your LGBTQ patients at both your institution and on a national level. Join Doctors for America and learn more about how to use your voice and experience to advocate for your patients and community.